We are joined by someone now who may not necessarily be as enthusiastic as we are about National Burger Day. Dr. Lantie Jorandby, you may, her website is lakeviewhealth.com. All right, doctor, what do you say about National Burger Day?
It sounds delicious. I would look forward to it. Yeah.
Very good. So you're not
Thank you for having me.
You bet. So you're not the doctor that's going to say, stay away from all the stuff you love, huh?
Well, not burgers, for sure. Cheeseburger with bacon sounds fabulous.
Oh, my gosh. I'm getting more hungry by the moment. All right. So we actually going to switch gears a little bit. Now, this ties into something we were talking about last hour, and also the question that you may weigh in on WIOD on Facebook, which is, would you rather use medical marijuana or an opioid to combat pain? Part of this, as we are watching what's going to happen with a case in Oklahoma today with Johnson & Johnson that has national implications, the prescription basis for opioids. We have seen plenty of research, including Dr. Jorandby, apparently doctors, dentists in the U.S. prescribing 37 times the number of opioids of dentists for like circumstances in England, for example. You walk us through a little bit of what's happening here and if we do have an epidemic of prescriptions in this country?
Yes, I'd love to. So that actually came out of a study they did in 2016. They reviewed the number of opiate prescriptions that dentists write over in Britain versus here in the U.S., just over 1 year. And it was really shocking. The number of prescriptions that we are writing here in the U.S. is about 1.4 million versus over in Britain, it's 28,000. So that is really a big disparity, a large difference between those two. And what I think is happening, and I hadn't even really thought of it until I saw these data, because typically a scenario I see as a doctor is a teenager or a young adult gets on opiates because they have a sports injury or they have some sort of minor surgery. But I never really thought about the dental kind of thing, because there is this kind of rite of passage where people get their wisdom teeth out, what, they're 18, they're 19, they're 20. And most of them apparently are walking away with a prescription for painkillers, a real serious one like oxycodone, Percocet, Vicodin, something along those lines. The thing that really kind of worries me is that young brains, teenagers, young adults in their early 20s, their brains are really susceptible to addiction because all of those circuits and all of the receptors are still in formation. They're still developing. They don't have a good, what we call that front part of their brain. Their prefrontal doesn't work as well. That's the area that helps you make decisions and impulse control. So it's just a perfect storm of sorts when you're handing an opiate to someone who's in their late teens or their early 20s like that.
What do you think is driving this? We have this case in Oklahoma that is going to be taken up today that would suggest that it's a profit motive being driven by the drug companies themselves. What is it from what you've studied?
There's a multitude of factors. You look at the drug companies, and yes, they've been culpable. There are a lot of them out there that have been pushing opiates as a good, quick way to take care of pain. We don't want anyone in pain. We even have considered pain the fifth vital sign. If you think about your pulse and your blood pressure and your temperature, they've added pain as one thing that you have to measure and then you have to manage. This has all been part of the medical community for many years now. So you have that piece of it. You have the pharmaceutical companies or the drug companies. And then you have doctors that either have been a little bit too lax in their prescribing practices or they've just been trained to prescribe opiates. They've been taught that opiates are safe. And this has been a message for at least 2 decades. So it's hard to change that educational piece of it very quickly. And I think what we're seeing, for instance, with this dentist thing is that the American Dental Association actually has come out now and they are actually proposing that we use Tylenol and Advil post-surgery rather than opiates. One, because it actually works better for pain. And then two, of course, we want to reduce the number of opiates out there and the number of people that might end up getting addicted to them. So the data actually shows that Tylenol and Advil are better pain relievers when someone has something like wisdom teeth or some form of oral surgery rather than giving them an opiate.
Well,
so you have a lot of different things happening.
It's a win-win-win, especially when talking about the cost out of it, too, being the third. Really good information. Thank you so much for joining us and taking the time. Do appreciate it.
Yeah, thank you for having me.